Walk us through what a typical day of a NeoGraft procedure typically looks like in the practice.
Sure. So typically our patients will come in pretty early. We start pretty early because the procedures can take several hours.
Mm-hmm.
So you can have breakfast, do your normal morning routine, have your coffee, and you come in. Typically we'll give you a medication to just make you a little bit more comfortable.
Right.
But essentially the procedure is done under local anesthesia. So we're able to kind of numb up and block the scalp. And then we harvest the grafts, and that usually can take 1 to 2 hours. Once the grafts are harvested, we prepare them, and then typically that's where we transplant them to the areas that we want to have new hair growth. And that can take, again, another hour or two. So typically the patients are here for at least 3 to 4 hours, and possibly a little bit longer depending on the case. But it's a very comfortable procedure. You're awake, we have a comfortable chair. It's almost like a massage chair, so a lot of patients take a nap. We have Netflix, so you can watch Netflix during the procedure. And then when we're done, you basically can leave here feeling very comfortable.
So after the patient receives the procedure, what does the patient recovery process look like?
So the recovery process is really pretty minimal. There's a bandage on there for about 24 hours. Then we have patients perform their own little wound care on the recipient site, but that heals pretty quickly. Within about 24 to 48 hours, those sites really seal up, and they almost become invisible very quickly. For the sites that we actually place the grafts, little scabs form around the hairs, and generally they fall off about 7 to 10 days. So from a recovery standpoint, from social downtime, if you don't want anybody to see the scabs,
Right.
you're looking at about a week or so.
Mm-hmm.
There is a little bit of swelling from the procedure, and that usually comes about day 2 or 3, and that can last a couple of days.
Yeah.
There's very little discomfort. Most of our patients really don't take any pain medication, or they take Tylenol or ibuprofen.
Right.